Good afternoon. Thank you for joining us for another session of our Advantage Academy webinar series. I appreciate everybody joining us today. This is a little different than what our other sessions were more, how to use your benefits, what to do if you have a question about a claim. And we thought we would throw a little content out there that would be more informative for you. And just to kind of give you some extra information about your health, and we're going to try to include some of these going forward. And next month we have a session on Part D benefits, so that will be more using your plan, talking about prescription drug benefits and how to access those and how those work, because as I'm sure you know, with Medicare, the Part D benefits can be kind of confusing. So anyway, welcome. We're just going to go through a couple of little housekeeping details. That's me, Tanya Sunderman. I'm the Medicare sales manager. And our presenter today is Dr. Kathryn DO. She is a cardiologist with Sparrows Thoracic and Cardiovascular Institute. So she is going to be doing a presentation today about heart health. I think the next slide, okay, this is what I wanted. So if you do have specific questions for Dr. Das, you can put them in the chat. If she has time at the end, she will try to get to some of those questions. We appreciate her taking time out of her busy day as a practicing physician to be here with us and to give us the information. So if she does have a little extra time, she will address those questions. You can put them in the chat. So if you click on the chat and type it in there, it does go to just the panelists. So it's just myself and a couple members from our team and to Dr. Das. After this webinar, we will send you a follow-up email. It will have a survey in it, so you can let us know what you thought. It will have a link to the recording of the webinar. So if you want to listen to it again, if you want to listen to it with a friend or a family member, you can do that. They are also posted on our member website. So if you have access to the member portal, and if you don't, you can call customer service and they can help get you set up. But we do have a playlist on YouTube of all of our recorded sessions so far. So if you missed any of those, you can click on that link and we will send that to you. And you can go view any of the prior ones or this one that we do today. We will send you a copy of the presentation. It is a PowerPoint. And if we do have an FAQ and fact sheet, we will send that. We have those for the ones that we do about the plan. This is not really a session to ask any specific questions. So if you have a specific question about maybe a service that you've received or a specialist visit that you had and how that's paid for under the plan, all of those questions regarding claims and requests and things like that need to go to customer service. And that phone number is listed here on this slide. It is listed at the bottom of the slide, and it is also on the back of your card, whether it's Sparrow Advantage, PHP Advantage, U of M Health Advantage, or Covenant Advantage. It is on the back of that card. So if you do have any specific questions services that you received and how it's paid for, please contact customer service and they can help you with that. There is also an email address that you can access as well. So here's our quick agenda: the importance of heart health, coronary artery disease, who's at risk, and healthy habits. And then I believe we are ready to turn it on over to Dr. Das.
Hi, everyone. Can you hear me all right? Okay, let me see. Don't think I can take over the presentation, so you'll have to drive. All right, so the goals of my presentation, I'm talking about your heart health, is to understand what cardiovascular disease is and why it's important to you. Learn about coronary artery disease and the important signs and symptoms to recognize that should prompt you to seek medical care. I'm going to briefly touch on the diagnosis of coronary artery disease and review risk factors for cardiovascular disease, and then discuss preventative strategies for cardiovascular disease and ways to stay heart healthy if you already have established cardiovascular disease. So heart disease, why does it matter? It's the leading cause of death in the United States. One person every 34 seconds dies from cardiovascular disease. In 2020, about 670,000 people in the US alone died from heart disease. That's 1 in every 5 deaths. And it has a huge financial cost to not only the healthcare system, but also you as a person in terms of lost wages and things like that. It cost the US $229 billion per year last year. So what is cardiovascular disease? This is kind of a busy slide, but as you can see, it encompasses a lot of factors. Starting out at the top here is atherosclerotic disease, which is, coronary artery disease or peripheral vascular disease, which can encompass, basically all of the arteries outside of the heart. Arrhythmias, which is abnormal heart. Coronary artery disease, peripheral arterial disease, that's more of kind of your plumbing problem of your heart. And the arrhythmias are more of an electrical issue. So abnormal electrical heart function. So the ones you may hear a lot about that have implications for strokes and stuff as you get older, and have more medical problems, is atrial fibrillation, or you may hear about ventricular tachycardia, which has implications on, your heart function, and you can die from ventricular tachycardia. Another aspect is valvular heart disease. So this may be, stenosis, valvular stenosis, like aortic stenosis. You might hear a lot about as you get older. That's a common problem. Or regurgitation. So stenosis is when the valve is too calcified or narrowed and it doesn't open and allow blood out where it's supposed to go. Regurgitation is when the valve doesn't close. Think of the valve as a door, that it doesn't close properly and causes blood to backflow. And that as you get older, some of the more ones you might hear about is mitral regurgitation tends to be problematic, and we may need to address. You can also have leaking from the aortic valve. You can have issues primarily on the left side of the heart valve, which is the main pumping chamber of the heart. The other part of cardiovascular disease is an aneurysm. So it's a balloon-like bulge in the artery. So you can have them up top, and you can have them down lower in the abdomen. And you may have been screened for an abdominal aortic aneurysm, and you may be monitored for those, and we monitor the size, and then at some point you may need to have a repair on that if it gets to a certain size. The other issues are cardiomyopathy. So that is a weak it's a broad term, so it can mean that your heart becomes too thick or too thin, and it can become dilated and ballooned. And people with cardiomyopathy can also have heart failure, which, because of the weak heart pump, it causes blood to back up. And then as we have gotten better with medicine, we are seeing people with congenital heart disease living, which is a heart defect that you were born with, and they're living later into life. So we also see those. So that's the main. There, as I said, it's a broad topic. So when you hear cardiovascular disease, it covers a lot of components. So our talk today is mostly going to be on, coronary artery disease and atherosclerotic disease. So coronary artery disease is also known as coronary heart disease or ischemic heart disease. And what it is plaque buildup in the walls of the arteries that supply blood to the heart. This process of plaque building, it leads to progressive narrowing of the arteries over time. And some people don't know that they have it, or they have subtle symptoms, and you may not know it, and the first time you find out you have it is you're in the hospital with a heart attack. So what is coronary artery disease? It's the most common type of heart disease in the United States. That's why I picked that topic to kind of focus on. It kills 382,820 people in 2020. Over 2.1 million adults over 20 years old have coronary artery disease. And a heart attack occurs every 40 seconds in the US. So we see them about 805,000 heart attacks per year. And of that, 605 are first-time heart attacks. And some people don't even realize they've had a heart attack. 1 in 5, about 20% of heart attacks can be silent. So a heart attack, you may also hear it referred to as a myocardial infarction. It's when the heart muscle, when a part of the heart muscle doesn't get enough blood. And this can lead to damage of the heart muscle. So time is muscle. So if you have a closed vessel, you need to get to a hospital so they can open the blood supply back to hopefully minimize the damage to the heart muscle. And this is most often caused by coronary artery disease, plaque buildup. There's a few rare instances. I won't go into the red herrings, but that's the most common cause of why you'd have a heart attack. So there's a variety of signs and symptoms that you may hear. You might hear about that typical crushing chest pain that's in the center of your chest. It may feel like an elephant is sitting in the center of your chest. But not everybody has those symptoms. Usually these symptoms come on initially in a stressful situation, or when you're strenuously exercising and you may kind of brush it off. And then over time, the symptoms can come on with lower levels of activity, to the point that now you might have pain with just chest pain sitting there. And some people, particularly that have diabetes, don't have any symptoms at all. So some of the other atypical symptoms that you may see, or not, you might not have that chest pain or pressure. Men and women can display signs differently. And as people get older, they tend to also have different symptoms. If you may just have a sensation of nausea or vomiting, or you may feel neck or jaw or upper back discomfort, rather than just that squeezing chest pain. You may feel some shortness of breath. Women sometimes may feel more fainting or lightheaded, or kind of like a heartburning sensation, but men can feel that too, or just extreme kind of fatigue. So the key is, if you're having any of these symptoms brought on consistently when you're exerting yourself and moving around, and you're starting to notice they're getting worse, that may be a sign to bring up with your doctor to talk about, hey, could this be my heart? So we do a lot of testing to diagnose coronary artery disease. You may get an EKG, which checks out the electrical rhythm of your heart. And this can show us if you've had a prior heart attack, depending, that an area doesn't have any electrical activity because it had a previous heart attack. So we can tell that sometimes on just the electrocardiogram alone. But if you haven't had a heart attack, we have to do some other testing. We can get an echocardiogram, which is an ultrasound of your heart muscle, and we can see what your heart squeeze function is doing and look at the valves. We won't see the arteries directly, but we can see wall motion. So if there's a problem with the blood supply, sometimes that we can tell based off the echo where, that there might be a problem with the heart arteries. And then to test, if you're having narrowing, we can do a stress test, and there's a variety of, treadmill or chemical stress tests, and we may add imaging like an echo with it, or a nuclear stress test, to get a better picture of where the problem is. A coronary calcium score is one that can be offered if you don't have any established coronary disease, and and say you don't know if you need to be on statins, or you don't need, you're not sure if you just want to know where your risk lies. And as you get older, generally your risk is going to be higher. But a coronary artery calcium score is something that can be offered to kind of see if you have plaque in, or see if you have calcified plaque in your heart arteries. This is a self-pay test. It's not appropriate for everyone. Also, there's a one that's called a coronary angiogram, a CT angiogram, where we can put you in a CT scan and actually look at your heart arteries and the plaque. As you get older, it's natural to have some calcium start to build up in your heart arteries. So it isn't always the best test as you get older if you have a lot of calcium in your heart arteries, because it can lead to artifacts. But the ultimate gold standard to really tell, do you have plaque, is this angiogram. So younger, we might, if I don't think that they have significant blockages, I may just do a coronary CT angiogram. But if I'm thinking that this person has actual real disease that may be causing their symptoms, then we would, if depending on the stress test, we would proceed to a heart cath, and that directly looks at your heart arteries and has the ability to fix it if there's a problem. So what are your risk factors for coronary or cardiovascular disease? So as you get older, of course, that's also a problem. Your sex, your gender, so hormones play a role, have some protective effects for women until they hit menopause, and then their risk of heart disease also goes up. Men's starts to rise in their risk of heart disease starts to rise in their 40s, women's starts to rise in their 50s. Certain race, ethnicity plays a factor, and some of this also has to do with some socioeconomic factors and access to healthcare that also plays in. And then of course genetics. You can't modify genetics, so those are all things that you can't do anything about. But your social factors, the environment you grow up in, the income, people that don't have are lower income, don't have access to healthcare, tend to unfortunately have higher burdens of disease because they don't have the means to seek out preventative care, or maybe are afraid to seek care because of the cost that's associated with care, or just plain education aspects. They're not aware of those symptoms that could be a problem with their heart. And then the location. So if you're in a rural area, you might not have access to all the care that you need. So those are all certain social factors that can impact your risk for cardiovascular disease. Now your traditional risk factors that you'll see is people that have diabetes, smoking, being obese or overweight, if you're sedentary or physically inactive, if you have high blood pressure or high cholesterol. Those are all factors that can contribute to development of cardiovascular disease and coronary artery disease. Now, women have a certain subset that puts us at risk for some of these problems later in life. If you've had high blood pressure during pregnancy, preterm delivery, if you've had gestational diabetes, that poses a risk for diabetes later in life. It also poses a risk for having hypertension later, high blood pressure later in life, and it also preeclampsia or eclampsia, if you've ever had that. It also raises your risk 2 times for having cardiovascular disease later in life. So those are factors that you might not think of that would play a role, but they do impact your risk later in life. Certain breast cancer treatments or radiation treatments, certain cancer treatments in general, but radiation treatments to the center of the chest can lead to scarring in that area where it was treated. The newer forms of radiation are much better tolerated, but older forms of radiation where they radiated the whole chest can lead to scarring of the muscle layers, and it can also lead to scarring of the heart arteries that can lead to narrowing over time. And certainly mental health, depression can play a role, and people not maybe ignoring their symptoms, not seeking out help when they're having them. So I'm going to focus on primarily the main traditional risk factors. So high blood pressure, hypertension. It's also called hypertension. It's high pressure in the arteries and other blood vessels. It's often called the silent killer because it usually has no symptoms. And uncontrolled hypertension affects your heart and other major organs of your body, including the kidneys and brain. So long-standing uncontrolled high blood pressure can lead to problems with kidney disease or kidney failure, can lead to strokes or what we call, vascular dementia issues later in life. And it can cause heart attacks. So you diagnose high blood pressure by checking your blood pressure using a blood pressure cuff. And your doctor will do that. You may have one at home. And the mainstay initial treatment is lifestyle modifications, and then if needed, medications. And we'll talk about more lifestyle modifications in the coming slides. But there is certain guidelines that your primary care doctor may go for that may have a little bit of a higher target of blood pressure. I tend to use the ACC-AHA guidelines, which give the normal blood pressure of less than 120/80, and then elevated blood pressure readings over one that, if I'm treating blood pressure and I'm starting somebody, I generally want my target blood pressure to be less than 130/80. So high cholesterol, also you can call it hyperlipidemia, or you may hear it referred to as dyslipidemia. Cholesterol itself is a waxy fat-like substance that's made by the liver and is present in certain foods that we eat. Excess cholesterol can build up in the walls of the arteries and lead to narrowing, like we talked about before, atherosclerosis. Caused by poor diet is part of it. Genetics are also a big thing at play. Or conditions such as diabetes and obesity can contribute to high cholesterol. Again, this is another one that usually doesn't have symptoms. You measure it with a blood test. So, if you get annual labs for your primary care doctor, they may check a lipid panel and look at those levels. On that panel that you get, they'll list an LDL, which is a low density lipoprotein. That is your bad cholesterol that can lead to plaque buildup. The HDL, which is your good cholesterol, it's called high density lipoprotein, has some protective effects against heart disease with higher levels. So the problem is a lot of people have higher bad cholesterol levels and lower HDL or good cholesterol levels. And then triglycerides is a type of fat that is used for energy, but it can increase your risk of cardiovascular disease if it's elevated. And that tends to be higher. There are some genetic factors, familial factors, but you can tend to have a lot of high blood pressure if you eat a lot of fried foods, fatty foods, things like that can raise the triglycerides a lot. Again, this is treated with lifestyle modifications, sometimes requires medications. So I listed this chart of the optimal cholesterol levels, ideally around 100 for that bad cholesterol, 100 to 130. Now, if you have established disease, if you've had a prior heart attack or a prior stroke or established plaque in your heart arteries, that bad cholesterol target is set at a lower bar. You have the recommended goal is less than 70. And even if you're there without medication, sometimes they still want to put you on a a cholesterol medication to stabilize any plaque that you do have. So diabetes, it's a chronic disease that affects how your body turns food into energy. It leads to sugar buildup in your blood from inability to make insulin or use the insulin your body makes. It leads to increased risk of death from heart disease. It can be diagnosed with a blood test. Either, a basic metabolic panel, they may check something like a hemoglobin A1C, depending. Your primary care doctor may check that. And then it's treated with lifestyle modifications initially, and then if needed, medications. So some of the signs and symptoms of diabetes, you're going to the bathroom, urinating often, slow healing of cuts or wounds, increased thirst, unintentional weight loss. You don't know why you're losing weight and you're having these other symptoms. You're always hungry, you're eating a lot, extreme fatigue, blurry vision, tingling in the hands or feet. Those are some signs to look for diabetes. And then obesity is excess body fat. It's linked to higher bad cholesterol and triglycerides and to lower good cholesterol. Obesity goes hand in hand with high blood pressure, diabetes, and heart disease. Even if you are obese, even a modest amount of weight loss, 5 to 10% of your total body weight, can produce health benefits, even if you still remain overweight or obese after losing weight. Even just that small amount can help. So the mainstays is lifestyle modification, and there are some medications that can help in addition to the lifestyle modifications. So tobacco and alcohol use. Obviously, tobacco use increases the risk for heart disease and heart attack. Also leads to lung cancer, and it does that by cigarette smoking damages your heart and blood vessels. Nicotine can raise the blood pressure. The carbon monoxide that you get from smoking cigarettes reduces the amount of oxygen your blood can carry. And these risks are even if you don't smoke yourself, but are around somebody that smokes, you're still at risk from tobacco exposure. If you drink too much alcohol, it can raise your blood pressure, can increase your triglycerides, and overall increases your risk of heart disease. So the recommended dose, if you don't have an underlying heart problem, would be to have no more than 1 drink per day for women, or no more than 2 drinks per day for men. And this is based off the standard drink sizes, which I included there on the slide. So a 12-ounce beer, an 8-ounce malt liquor, 5 ounces of wine, or 1.5 ounces of a 80 proof hard liquor. So diet and activity as the mainstays of lifestyle modifications. So diets high in saturated fats, trans fats, and cholesterol have been linked to heart disease. Excessive salt intake can raise your blood pressure. And unfortunately, not just adding salt, but a lot of foods themselves have a lot of sodium in there for preservatives. So it's important, which coming up, I'll talk about the food labels, is looking at your food labels to see how much salt is in, to gauge how much salt you're taking in on a daily basis. It's not hard to get to the limit, the recommended limit daily. And then not getting enough physical activity, living kind of a sedentary lifestyle, can lead to heart disease and increased chance of developing medical conditions that put you at risk for heart disease. So now I'm going to talk more about those lifestyle modifications. Increased fiber intake and reduced intake of saturated fats, trans fats, and cholesterol to help prevent high cholesterol. Limit sodium and salt in your diet, or limit sodium or also salt in your diet to reduce your blood pressure. And you want to limit sugar and carbohydrates to lower blood pressure or lower blood sugar and prevent or help control diabetes, and limit your alcohol intake. So these are the back there. So these are just the health benefits over here on the left of eating healthy. Helps you live longer, keeps your skin, teeth, eyes healthy, helps support muscle health, boosts immunity, strengthens your bones, helps with the digestive system, helps working towards a healthy weight, and lowers your risk overall of heart disease, diabetes, and some cancers. So you may have recognized back, years ago, the focus was on this pyramid. for your heart healthy diet, and that makes things more confusing. It doesn't really give people a picture of something that they can relate to when they're looking at their food plate. So several years ago, they transitioned to this My Plate that gives you, this is how your plate should look when you eat. You know, you don't want to do the food pyramid. You focus on this, you know, half of your plate should be fruits and veggies. A small, you know, quarter of your plate should be a protein. And then another quarter of your plate should be grains with that little dose of dairy. And there is a nice tool that you can, it's myplate.gov, that you can explore kind of what, you know, what the different things that fit into each category are, and how it looks. So that's a good resource to go to. And now I talked about how we would review the food label. They've made changes to the food label in the last few years. So your calorie target for somebody, when they put these percentages and calories and everything on the food label, it's based off of a 2,000 calorie diet, but that's not always the calorie target that everybody should be at. It varies based off age, based off activity level, based off of gender. So there's a nice, I included this link that you can go in there and plug your factors in. I think they even have it on the My Plate tool to kind of help you get a calorie target based off of that. When you look at a food label, you want to pay attention to the serving size on it. It tells you, you know, like this food label, it says 2/3 of a cup is a serving. And that's where people's downfall is usually with meals, is that they're eating more than the recommended serving size. And when they do the percentage of DV or daily value, it's the amount of nutrients in each serving. So if you see a percent that's 5%, that's generally something that's a low percent. And if you see something that is high, would be something over 20%. So if you're looking at something and the carbohydrates say 20% or 30% of your daily value, that's something that's really high in carbohydrates, and you might want to look for a better option. They changed how fats were, because not all fats are created equal. So trans fats are bad, saturated fats. So you got to look at those. You don't want a high percentage of the bad fats, the saturated fats, the trans fats. So you want to look for something that has a number of less than 5%, rather than looking at just the total fat, because, you know, olive oil will have fat in it, but that's a good fat. You want to keep your sugar intake less than 10% of your daily calorie intake, and you want to limit your sodium intake to less than 2,300 milligrams or 2.3 grams a day. But if you have high blood pressure or other conditions, your target is much lower. It's 1,000 to 1,500 milligrams per day. And you can see that, oh, if you want to go back just a second. Under here, you can see on the sodium, under sodium, it says how many milligrams are right there. So it's important to check that food label. Processed foods tend to have a lot more salt in them. So when you look at the label, you'll see, you know, lunch meats, olives, things like that actually have a lot of salt in them. So what is a heart healthy diet? Some will talk about the Mediterranean diet. The DASH diet is kind of a offshoot of the Mediterranean diet, in that it's one that is more focused on a low sodium, lower sodium diet, but you want to eat veggies, fruits, whole grains, fat-free or low-fat dairy products, fish, poultry, beans, nuts, and seeds, and vegetable oils. You want to try to avoid or limit fatty meats, full-fat dairy, sugar-sweetened beverages, sweets, and then sodium. And so this little diagram over here kind of did your My Plate, where you have the little slice of apples and the veggies, and then you have some lean protein and some whole grains, and it just gives you some examples there. and tells you, 3 to 5 servings of, non-starchy vegetables. It gives you all kind of how much you should be getting a day in each of those things. There's some nice additional resources that have the USDA has a dietary guidelines for America. It's a big pamphlet. It has anything that you would, if you have certain dietary limitations, you can go through and thumb through to see, where it fits. But that's an option. The USDA MyPlate, that's another resource to explore. This one here has some seasonal recipes, Million Hearts. It's a Health and Human Services website through the government. And then the DASH diet has a lot of resources as well with the National Health Institute. So lifestyle modifications, physical activity. So adults age 65 and older need at least 150 minutes a week of moderate intensity exercise or 75 minutes a week of vigorous intensity exercise. At least 2 days of the week should be focused on strength training. And then activities to improve balance should happen about 3 times a week. If you're less than 65, the balance training there is not stressed, but and some of the health benefits of physical activity, immediately you'll notice sleeping better, less anxiety, better blood pressure. Over the long term, it improves brain health, heart health, cancer, reduces risk of cancer, helps with maintain a healthy weight, improves bone strength, and improves balance and coordination. So this is a nice little example of how you could get your activity. So you could do a brisk walk for 150 minutes, 5 days a week, and do some muscle strengthening activities on 2 or more days. That would be like working all the major muscle groups. And then balance training 3 days a week, like walking backwards, standing on one leg, using a wobble board. You could mix it up and do vigorous intensity exercise for just 75 minutes a week, which is 1 hour and 15 minutes, the same amount of balance and muscle strengthening. Or you could kind of mix it up. In general, the vigorous activity is an activity counts as double what so you have 150 minutes or 75 minutes. So if you do a one day you did a brisk vigorous activity for 30 or for 15 minutes, that's equivalent to a 30-minute moderate intensity workout. So that that you can mix it up. So physical activities, aerobic exercise, so mowing the lawn, raking leaves, learning a new dance, walking to the store, hiking a trail, or doing active forms of yoga, riding a bike, stationary or outdoors, joining a water aerobics class. Everyone has a different fitness level. So like I talked about, the 2 minutes equals 1 minute, 2 minutes of moderate equals 1 minute of vigorous. A good way to kind of gauge if you're doing more vigorous activity or more moderate activity is the talk test. So you can talk if you're doing a moderate level of activity. You couldn't be able to sing, but if you're doing a vigorous level of activity, you can't say more than a few words without pausing to take a breath. The other way is to follow your target heart rate. So your target heart rate is 220 minus your age. That gives you what your 100% age predicted heart rate should be. And moderate intensity exercise targets a heart rate anywhere from 64 to 76 of your maximal. And vigorous activity targets anywhere from 77 to 93%. So I don't know if many of you have a smartwatch or a Fitbit, you can keep track of your heart rate, and that's a way to tell kind of how vigorous of activity that you're doing. So muscle strengthening exercises, lifting weights, working with resistance bands, doing exercise that uses your body weight for resistance, like push-ups or sit-ups, digging in a garden, doing some yoga postures. So it's all about repetition, which is a complete movement of an activity. So you do one set is 8 to 12 repetitions. Ideally, you want to try to get 2 to 3 sets in, but at least trying one set to start out would be beneficial. So there, likewise for this, there is activity recommendations. They have good resources. There's physical activity guidelines for Americans. This has various activities, you know, even if people have arthritis and things like that, it has some suggestions on what you can do. And then growing stronger, strength training for older adults. Again, these are some reputable sites to get some good educational material on how to improve your physical activity. So overall tips for staying healthy. Heart disease is the leading cause of death in the United States. You want to choose healthy habits. So choose healthy food and drinks, keep a healthy weight, get regular physical activity, and don't smoke or drink excessive alcohol. You want to take charge of your medical conditions. Check your cholesterol, control your blood pressure, manage your diabetes, take your medications as directed, work together with your healthcare team to address any concerns that you may have. And then again, I have additional resources and reference. You know, the CDC has a lot of good resources. There's a Million Hearts Initiative. The NIH has a lot of resources, Medline, the American Heart Association, you know, Mayo Clinic has a lot of good references on disease and things like that, even Cleveland Clinic. They have a lot of good educational material there. Google can be kind of a double-edged sword, but if you're looking at the right resources, it can give you a lot of information. So, I think I have a little time for some questions. Let's see if I have. So let's see, somebody asked, hold on, how can I make this bigger? So somebody asked, is it hurtful or beneficial to exceed maximum heart rate during vigorous workouts? If you exceed it, it's not going to be overly harmful, but I wouldn't push it to your excess over 100 for a long period of time. I don't think it's necessarily beneficial to go maximal above, because they say the target, you know, you're getting still good target when you go a moderate to vigorous amount of activity. So somebody asked, does a statin medication help to reduce the plaque buildup in your arteries? So a statin, if you have plaque buildup, it's not going to reduce the plaque that you do have, but it will hopefully prevent plaque from building up, and it'll stabilize the existing plaque that you have so it is less vulnerable to cause a heart attack. So somebody asked if HDL is high with low triglycerides and LDL, but overall number is high, is cholesterol treatment desirable? So sometimes your cholesterol number could be higher because it's a calculated, we focus on those specific subsets, your HDL being high and the other two being low. So ultimately you have to talk with your physician if it's right for you They put you into there's a risk calculator that they can put you in to determine if treatment is necessary. So that's kind of a complex question to ask. And just rather than saying a blanket term, no, ultimately we have to look at what your risk profile is. Is your low cholesterol where we want it to be based off of your risk profile? So it's hard to say. Ultimately, it's important to have these discussions with your physician based, knowing what medical problems you do have. Let's see. So somebody asked, would you recommend a calcium scan for people that have family with cardiovascular problems? So ultimately, this is another question that's important to talk with your cardiologist or your primary care physician to determine if it's right for you. It's a calculator that we use if you don't have established disease. It's a 10-year risk of atherosclerotic cardiovascular disease, and they plug in a bunch of factors. They plug in your blood pressure metrics, your cholesterol metrics, and it spits out a 10-year risk score. And those people that, are kind of the low to intermediate risk, you can talk about, or that kind of moderate risk could talk about, should I get a calcium score? And if the calcium score indicated that I did have some plaque, then maybe I need to be more aggressive at treating my risk factors and maybe even considering a statin medication. But that's not right for everybody. If they're having symptoms, sometimes, doing another test would be more beneficial, but it can be beneficial, particularly in those people that are, in their 40s or 50s that are kind of, do I need to start a statin or not? Sometimes, yes, with family history, it might be beneficial to get that. But ultimately, you got to kind of talk that through with your doctor. I think we offer them through Sparrow. They are $100 self-pay. So as we get older, sometimes they're not as beneficial because we start to have, if you have established disease, then a coronary calcium score is not going to give us any more information. Let's see. Oh. Okay, let's see. I think there was one more question. So somebody asked, would you recommend a higher percentage of the plate for older adults? It's a standard size plate. So ultimately, it doesn't change based off of, if you're older. There's certain factors that you may have to have more protein or less protein or things like that. But it's a standard size plate. Ideally, if you're going to increase anything, it should be more veggies, and try to limit more of the carbohydrates or grains. But your target based off of how you construct a meal is, if you go into that help tool, you can see based off your age, based off your activity level, based off your gender, where your calorie target should be, and then construct a meal that way. I think that is all the questions. Oh, somebody said, what causes heart failure? Same as coronary artery disease. So heart failure can be caused by it. That's probably a presentation in itself. Coronary artery disease can lead to heart failure because it can cause weak heart muscle, which can lead to heart failure. But there's a lot of other things that can cause heart failure as well. Drinking too much alcohol can weaken the heart muscle and lead to heart failure. Like I said, that's probably, that would be a separate whole discussion on heart failure, because it's a huge topic. And again, somebody talked about heart electrical issues with the heart. So that's again another, I don't know, it said heart recam and electrical issues. So that's again another probably topic to discuss. Oh, and somebody, Janelle responded that she meant protein. So there are certain things that you should increase your protein, but I'd ultimately talk with your doctor if it's more beneficial to get more protein. Let's see. And then so ultimately, somebody asked if one of my symptoms is shortness of breath, how can I get more exercise in? Ultimately, if you haven't been worked up for your shortness of breath, that's something probably you need to talk with your doctor about to kind of get a action plan for why you're so short of breath. Certainly, there's a lot of medical issues that can lead to shortness of breath. And then sometimes you get sometimes shortness of breath can happen just from, deconditioning or excess weight. And ultimately, it's a matter of, working on, if you have excess weight that you need to lose, trying to work on some weight loss to see if that starts helping with your breathing. And then if you get short of breath, ultimately I would talk to your primary care doctor or your cardiologist or who you have first to explore why you're short of breath. And if you've had a workup and they've ruled out all the bad stuff, then it's about talking about how you can increase your endurance gradually. I think that is it.
Okay, thank you so much, Dr. Doss. That was really informative. I appreciate you taking time to answer the questions in the chat. Thank you, everybody, for attending. Our last slide is just our upcoming webinar in May is on the 17th at 10 a.m. That is going to be Part D, your prescription drug benefit session. There's a QR code that you can scan with your phone and register, or we will have a registration link in the follow-up email that we send you as well. So thank you so much, everyone. I appreciate you all joining us today, and I hope everyone has a great afternoon. Thank you.
Bye.